From the 22 News Plus studio, this is 22 News in Focus with Patrick Berry.
Hello, everyone, and welcome to this edition of InFocus. I'm your host, Patrick Berry. We are here in the 22 News Plus studios. If you watched on the 22 News Plus app an interview a few weeks ago with Dr. Rachel Volberg from UMass on the state of gambling here in Massachusetts, and we touched a little bit on it around the country, it is a fascinating conversation. We didn't get enough time to really wrap up the conversation to talk about the social, health, and economic issues that come with gambling. So Dr. Rachel Volberg is back here in the 22 News Plus studios. Dr. Volberg, thank you so much again for joining me here. I really do appreciate your time. It is such a fascinating conversation, which we weren't able to complete a couple of weeks ago. And that really is, the social and health, as well as the economic side of gambling. I want to start with the economic part of gambling. As an outsider looking in, I look at it as building casinos anywhere, and Massachusetts, because we live here, I look at it from an economic standpoint as being a good thing. It created temporary jobs for the construction. Then it created hundreds of ongoing jobs, whether it's, the dealers or the janitorial staff or the hotel staff. It has created a number of jobs. But again, I'm the outsider looking in. You are involved in this. Am I on the right track?
So it's important to distinguish between casino gambling and other forms of gambling.
Okay.
The biggest difference really is when you have brick and mortar casinos, as we call them, like buildings.
Like
people
Encore,
go to.
MGM.
Exactly, Plainridge Park Casino. When you have physical entities that people go to, that those properties have quite different economic impacts than forms of gambling like sports betting or online gambling that don't have physical plant.
So if I think of any of the sports gambling, they're all done via an app on your phone. There's no building I can go to. However, some of the brick and mortar places have embraced sports betting in their facility, correct?
Absolutely. All three of the casinos in Massachusetts had sports bars
Okay.
before they had sports books.
Hmm.
But when the sports betting,
But now, was that forward thinking on their part because they knew this was coming, or?
well, they were hoping, I'm sure. But lots of casino patrons are sports betting aficionados as well, and so it was kind of a natural fit. But the sports betting legislation that passed in Massachusetts in 2022 distinguished a number of different types of sports betting licenses. So the Category 1 licenses were for the brick and mortar, and then there were Category 3 licenses that were online only. And the brick and mortar operators are permitted to have physical sports books in their properties, but then also a number of what are called skins, which are brands that they that are also associated with their property.
Okay. So circling back to the economic side of it, the brick and mortar has or has not benefited, let's say, Massachusetts as a whole.
So looking back from 2013, when we started our study of the social and economic impacts of gambling in Massachusetts, which was before there were any casinos, in fact, before we even knew where the licenses were going to be issued, we've been looking at from the economic perspective, we've been looking at the construction impacts, the employment impacts, and the patterns of spending by the three operators that are licensed in Massachusetts by the Gaming Commission. Their spending within the state. So each of those operators, in applying for their license and in arguing to get the license, made very specific commitments to employment, numbers, local hiring,
Right.
diversity hiring, vendor spending was there were commitments to spending money in Massachusetts, um,
Those
construction as
all sound
well.
like positive results of the gambling, legalizing gambling here in the state.
Yeah, and the legislation was very specifically written. Those were criteria that the Gaming Commission was required to take into consideration
Okay.
as they considered who to issue licenses
Right.
to. So, the legislation also required each of the licensees to establish uh, host and surrounding community agreements. So
Hmm.
spending that they basically money that they hand to the city of Springfield and to the surrounding communities out here in Western Mass. Um, the same in the Boston area and in the Plainville area. Commitments to the host and surrounding communities in terms of money that they pay over annual. So there's a lot of um, positive economic impacts, benefits that come from a brick and mortar type of gambling establishment, as long as those sort of performance criteria are maintained.
Okay. So the brick and mortar they need to meet certain criteria that's delineated within the legislation.
Well, no, the legislation said that they had to have criteria that they were judged
Oh,
against.
okay.
And then the Gaming Commission said, well, if you want to be competitive to get this license, say in Western Massachusetts, come up with some really strong positive commitments. And so MGM has commitments in terms of number of local people that they hire,
Okay.
also diversity in their hires. So, hiring folks from minority groups, et cetera, women. Um, and then they also have a pretty substantial host community agreement with the city of Springfield, which brings the city quite a lot of money on an annual basis that they can spend however they want.
Very good. We are up on our first commercial break. Stay with us. We've got plenty more to talk about. We're back in just a moment.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to the 22 News Plus studios. Sitting across the desk from me again is Dr. Rachel Volberg from University of Massachusetts. She is the preeminent specialist on gambling, and I thank you very much for being here. Several weeks ago, I had you first here in the studio to talk about the state of gambling, and now we were unable to finish that conversation because I wanted to get into the social and health and economic challenges, benefits of gambling here in Massachusetts, which is what we are talking about today. So thank you again for giving me your time. The economic benefits, I want to stick with that because that's where we were. It's, if I understand correctly, if you boil it down, brick and mortar, definite economic benefits to the state of Massachusetts. Online,
With a caveat.
with a caveat.
The caveat is that the legislation has to put guardrails around what the operators are required to do so that those economic benefits do move out to the community.
Okay. So then additionally, after that, it was a benefit for a number of things. I mean, downtown Springfield has vastly improved. There are, I don't even know how many people are employed by MGM.
About 2,000,
so
somewhere between
so
2 and 3,000.
that's a lot of jobs that weren't here 15 years ago. And not to mention the short-term construction jobs that were created, and then the ongoing maintenance, HVAC, whatever the maintenance of a building goes.
Laundry.
Laundry, right. So it sounds as if it's been a good thing for Springfield.
There have been positive economic benefits.
So let's talk about some of those employment benefits that the region is seeing.
So the MGM, as part of the process of obtaining a license, had to commit to certain uh, employment targets that they report quarterly to the Gaming Commission on whether they are meeting those targets for the quarter.
So it wasn't just upon opening they needed to meet these
No,
targets.
it's
It's ongoing.
ongoing. Yes, and they are checked on 4 times a year.
Wow.
Um, so it's a pretty serious business. The Gaming Commission takes, as it should, takes that reporting very seriously, and each of the operators comes before the commission on a quarterly basis, give their reports on numbers of local hires, proportion of and numbers of diversity hires, so women, veterans, and
Hmm.
minority targets that they are expected to meet, and also targets in terms of local vendor spending. So, instead of taking all of their, you know, employees' uniforms, which, most employees have a number of uniforms,
Hmm.
but the property arranges for those to be cleaned on a regular basis. Uh, the laundry facility that they chose in Springfield was a local
Okay.
operator, so it was a business benefit.
Now, when you're talking local vendors, I have to imagine, like I said, I used the analogy earlier of HVAC
Mhm.
rather than outsourcing to a national company. They're using local,
Yes, yes,
local, so that benefits.
and that's partly because they have targets that they need to meet in terms of local vendor spending.
Okay. So beyond the economics of employment and vendor spending and equality of diverse equality
Diversity.
diversity, one word, diversity among their employees, how else has the casino either helped or hurt Massachusetts economically?
Are we talking about just MGM and Western
Brick and mortar,
Springfield? Brick and mortar.
brick and mortar.
Um, well, obviously there's tax revenues.
Okay.
So in the case of the resort,
So really, it's found money for the state of Massachusetts that wasn't there 15 years ago.
well, it's found money, but where is it coming from?
Okay.
So
Does
one
that
of the
come to the social and health
yes,
impacts that we'll get to?
one of the big um, rationales for legalizing casinos in Massachusetts was there was a report that was published, I'm gonna say 2009, 2011, somewhere in there, that suggested that about $1 billion a year was leaving Massachusetts because Massachusetts residents were going to casinos out of state to gamble and spend their money.
$1 billion a year leaving Massachusetts.
Yeah, and so
And when you say go out of state, obviously Connecticut, Mohegan, and Foxwoods.
New York,
Okay.
Connecticut, Las Vegas.
Okay.
It wasn't just confined
Regionally.
to Connecticut, but that was one of the
Okay.
main places that Massachusetts residents could go to, and it was convenient, in terms of being next door. But that was quite an eye-opening number
Right.
for a lot of people, and the rationale legally was that the legislature wanted to recapture those dollars and at least have them be spent in
Right.
Massachusetts to benefit Massachusetts residents.
So I look at that as, our politicians aren't dumb people. They see this money going elsewhere. It's like, how can we capture that? Well, let's legalize
Yeah,
gambling.
but the challenge with with any kind of a brick and mortar casino is attracting out of state
Right.
gamblers.
So
So
even though you're keeping or trying to keep the money that was leaving Massachusetts within the state, attracting out of state people to come here.
exactly. So well, I don't want to get into the details of between recaptured money and reallocated money, but those
Okay.
two types of spending have different economic impacts because recaptured spending is people who Massachusetts residents who would have gone to a Connecticut casino, for example, but decided to gamble that money at a Massachusetts casino. That's recaptured. And there has been some significant recapture.
Okay.
Um, the more economically concerning piece is reallocation, because a new casino, for example, might bring people in who haven't gambled at a casino previously, but liked to go out to fine restaurants or liked to
Hmm.
go to movie theaters or to live performances,
Okay.
and instead are shifting that money to spend it on going to the casino. That's reallocated money, and it does not have a net benefit for the state of Massachusetts because it's money that people would have
Would have spent at
spent
other
at other
establishments. Right.
establishments now going to the casino.
We are up on our second commercial break. Stay with us because when we come back, we'll wrap it up, talk about the social and health issues that have stemmed from gambling. We'll be right back in just a moment.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to the 22 News Plus studios for this edition of InFocus. I'm your host, Patrick Berry. Sitting across the desk from me today, returning from UMass, is Dr. Rachel Volberg. She is a research professor of the Health Sciences department up at UMass. Dr. Volberg, thank you so very much for joining me. A month or so ago, several weeks ago, we had a very first conversation about gambling here in Massachusetts, and we weren't able to get to the economic, social, and health aspect and impact of gambling. For the first portion of this, we've talked a lot about the economics of gambling, and I think it's a net benefit if I it can boil down what you've said so far. But let's now get into the social and health aspect of gambling. And now, we need to clarify. There's a couple sets of types of gambling. There's the brick and mortar MGM, Foxwoods, that kind of thing, and Everett and Plainridge Park. And then there's the online gambling, two completely different things. Is online gambling better or worse for the social and health impact than a brick and mortar?
Well, I'm going to say worse.
Okay. All right.
It's a much more immersive product. There is a substantial amount of research that's been summarized by the Lancet Public Health Journal had convened a commission on gambling that issued a report at the end of 2024 that found that online gambling, including sports betting, but also online slot machines, was a particularly risky gambling product in terms of being associated with gambling problems.
Okay. I go back in time. My own personal feeling 15 years ago when they first started talking about casinos was that this is only going to exacerbate the gambling addiction problem for Massachusetts residents. There is the benefit of the tax revenue and the entertainment, but was my thinking back then off base? Has the number of gambling addicts skyrocketed since they legalized gambling here in Massachusetts?
Well, you're not mistaken in the sense that that's a piece of conventional wisdom, and there is research that shows that when you introduce a new form of gambling into a jurisdiction, um, because of the exposure effect, which is an epidemiological term,
Mm-hmm.
but because of that exposure, a large number of people or a substantial number of people will experience gambling problems. However, we are not talking about a naive or unexposed population in Massachusetts because for example, the Connecticut tribal casinos became operational in the mid 1990s.
Okay.
And where have Massachusetts residents who wanted to gamble at a casino been going?
And it's
Very
not a far,
often,
long drive, so
very
you're already
often,
exposed.
exactly. So we had an already adapted population in Massachusetts. And my research team and I, back in 2013, we did a baseline survey, and we were like, that's weird, because we had asked people about their past year experience with gambling at a casino, and I believe it was 23% of our Massachusetts residents aged 18 and over had gambled at a casino in the past year, the majority of them at the Connecticut
Right.
casinos. And we thought, well, that's interesting because, this is already quite an experience. The portion of the population that wants to gamble at a casino has been able to do that for quite a long time.
Mhm.
So when we did our follow-up general population survey in 2021, we were not surprised at the finding, which was that there was no significant increase in the prevalence, that is the proportion of people in the population with a gambling problem. No significant change from 2013 to 2021. The one thing that did change, which we were concerned about, and we highlighted it in our report, is that the proportion of revenues going to the casinos from at-risk and problem gamblers had increased.
Okay. All right. So for those who already had a problem, the proximity to gamble just exacerbated that problem. There wasn't an increase in the number of people, just with a gambling problem,
Severity.
just the severity of it.
Yes,
Okay.
that was our conclusion based on the data that we collected.
I know one of the big concerns from citizens around the state when the casinos were first talked about is an increase in local crime. Have you seen that?
There has been a small increase in crime, but it's very specific to the properties themselves.
Oh, interesting. So Springfield's
So,
different from Everett and
well, it's more specific to people. People in casinos tend to carry around a lot of money,
right.
and
Makes sense.
so the sort of the not armed robbery, but like burglary, like smashing into cars and stealing things. There actually were upticks in those kinds of crimes in both Everett and in Springfield following the opening of each of those casinos. The other sort of public safety issue that does appear to have been increased significantly is traffic accidents and alcohol-related traffic accidents
Right.
in particular.
That kind of makes sense. It's just more people coming to downtown Springfield or to Everett, more alcohol being consumed within a casino. That I don't think anybody didn't expect that to happen.
No, but it was interesting to document it,
Right.
because, and it shouldn't be any surprise, before you get a major change in the, sort of gambling landscape like this, um, the opponents are very strong, and there's going to
Right.
be this giant increase in the number of people with gambling problems. There's going to be this giant increase in crime. We're going to have traffic accidents all over the place. The proponents are like, but the money, the economic benefits are going to be so great. They're going to easily balance out the negative impacts. And as a longtime gambling researcher, I'm sort of like, well, it's not going to be as bad as you think it is, but it's also not going to be as great as you
Right.
think it is.
More of a moderation.
And so, the fear mongering on each side is kind of something that I observe with interest.
Very funny. Our time is up again. Dr. Volberg, thank you so very much for joining me today. To continue the conversation from last time, I'd like to invite you back because as sports betting becomes more prevalent in our communities, and then there will be online Massachusetts State Lottery online usage of that and some other things, I'd love to have you back to talk more about that if you don't mind.
I'll talk about gambling all day.
Thank you so very much. Good seeing you.
Thank you.
This is 22 News in Focus with Patrick Berry.